Now, Mr. President, I want to turn briefly to another issue, and I would ask unanimous consent that my remarks here be printed separately in the record.
Without objection.
Thank you, Mr. President. And, Mr. President, I want to spend just a few minutes to discuss women's health care, because I believe women's health care in America is in trouble, very deep trouble. And it's in trouble in the Congress, it's in trouble in the courts, and it's in trouble in our state houses. And in these bodies, I think that there really is a serious risk to women's access to affordable, high-quality health care. There's an assault on women's right to choose their own physicians and their own providers. And that assault is wrong. Drip by drip, state by state, the assault goes on. The latest example is in Florida, where lawmakers seem to be heading down the same road that Texas and Louisiana have traveled, restricting the choices of women. This all began with a Texas law, HB 2, that's been challenged all the way to the United States Supreme Court. Arguments were heard just last week. HB 2's backers have argued that the law is about protecting women patients. My view is that's pretty much fiction. HB 2 has very little to do with women's health. It's really a thinly veiled scheme to block women's health choices with unjustifiable requirements for abortion clinics. The AMA and the American College of Obstetricians and Gynecologists, people who obviously have expertise on this issue, have said very clearly in a legal brief, an amicus brief, that the restrictions are, and I quote here, contrary to accepted medical practice and are not based on scientific evidence. Despite the advice of the American Medical Association, the American Congress of Obstetricians and Gynecologists, Texas went ahead with the law anyway. If it stands, the number of clinics that provide abortion care will drop by more than 3/4. Now, HB 2's backers say it's about preventing complications from abortions, yet they ignore other procedures, colonoscopies, for example, that have much higher rates of complications. HB 2's backers say women who live where these clinics have shuttered can go to other states. But the fact is that we're hearing that that really isn't an option for so many women. Now, Louisiana just passed its own version of HB 2. Just yesterday, the news came down that legislators in Florida have passed a similar measure. The Florida bill goes one dangerous step further by going after funding for Planned Parenthood. Attacks on Planned Parenthood aren't anything new, not in state houses like Tallahassee or here in the Congress. When you threaten Planned Parenthood in this way, you're going far beyond restricting access to abortion. Here's the list of vital women's health care services which have absolutely nothing to do with abortion. And these services which have nothing to do with abortion are under threat. Pregnancy tests, birth control, prenatal services, HIV tests, cancer screenings, vaccinations, testing and treatment for sexually transmitted infections, basic physical exams, treatment for chronic conditions, pediatric care, hospital and specialist referrals, adoption referrals, nutrition programs. The fact is, this assault on women's health care is going to hit disadvantaged, struggling women hard across our country. There are countless women across America enrolled in Medicaid who rely on Planned Parenthood and similar programs for their basic, essential medical care. It's really their first line of defense for basic health services, particularly in rural communities, in rural Oregon. The women know and trust their doctors at those clinics. And without those clinics, they aren't going to have anywhere to turn for their care. If you're working an hourly job, you've got kids to care for on your own, pretty clear you're not going to find an easy way to take a day off work or travel far away for medical care. Yet these are the kind of laws that are being passed in states across America. These anti-woman laws are unfair. They're dangerous. Mr. President, this won't be the last time that I come to the floor to discuss this. My view is access to health care for women in this country is in trouble. And a number of the services that I've talked about are essentially part of what is a constitutional right. A constitutional right. Doesn't just mean it's a constitutional right if you're well off. It's a constitutional right because the United States Supreme Court has said it. And I intend to defend that constitutional right. I intend to do everything I can to build bipartisan support so that instead of women's health services being in deep trouble, as I've described today, women can know that those essential services are available for them across our country. Mr. President, with that, I yield the floor, and I note the absence of a quorum.
Clerk should call the roll.
Mr. Alexander.